Okay.
Hello, I'm Dr. Bittiker. I'm back to do another pause. This time I'm going to cover what's called gastropause, stomach pause. As we get older, a lot of times the digestive system, beginning with the stomach, doesn't work as well as it used to work. And it shows up in a lot of ways. One of the old-fashioned terms was heartburn. In fact, there was an entire industry built around treating heartburn. The fancy word for heartburn or upset stomach or indigestion is GERD. Stands for gastroesophageal reflux disease. In fact, there's around $26 billion spent on drugs designed to relieve the symptoms. Not cure it, but relieve the symptoms, and therein lies the problem. It's a huge industry. We have a lot of drugs that are sold over the counter. Some of them are sold by prescription. There's drugs like Prilosec, Protonix, Prevacid, Ranitidine, if I'm saying it correctly, and on and on and on, multiple different drugs, some by prescription, some by over the counter. And the point being is that in many instances, they actually do work as far as symptomatic control. But there's always some problems, and a lot of times I tell people, you need to pull out that little insert that's in that medication and read it, but because the side effects may surprise you. But that's one of the number one problems with gastropause is the inability to digest foods correctly with a lot of heartburn and things like that. Your stomach, after your mouth processes, your mouth is alkaline in nature, and it secretes certain enzymes there to process, mostly starches there, get the process started. Then it switches over to an acid medium in your stomach. Your stomach releases a lot of hydrochloric acid. It's supposed to do that. Your stomach is actually a little acid vat. It's supposed to be there. The purpose of the acid being secreted is to ionize minerals, to help break down amino acids and other things. Also to help break down and utilize vitamins and minerals. And then as soon as it passes out of the stomach and the liver secretes the bile to help emulsify the fats, it then switches over to an alkaline pH, and that's how the process of digestion continues down throughout the intestinal tract. And then in the colon, it goes slightly acid again. So it's back and forth. That's the nature of it. So people think that acid secretions in your stomach are inherently bad. No, they're not. It's supposed to be there. It's there for a purpose. Well, one thing is it sterilizes your food. And there's a reason for that. Because if you get a bacterial infection in your colon, you'll understand why you should have had acid in your stomach. And there's also some side effects about taking these medications. When I tell people, yes, you take something and it works for the symptoms, but do you realize what you're giving up and the side effects you may be getting into? Let me give you a couple things that may give you pause for thought about taking a drug when there's a natural approach to this that works even better, in my humble opinion. Here's a study, comes out of California. It says the Stanford Translational Research Integrated Database Environment study reported in Practice Fusion. It's easy for me to say. Anyway, it involved research on 16 million clinical documents of 2.9 million individuals. Pretty big study, I would say. And the team determined that GERD patients, gastroesophageal reflux patients, exposed to proton pump inhibitors, which are these drugs we're talking about, had at least a 16% increased risk of heart attack and death over the other population. And this isn't a huge study. Let me go to a couple others here. Another thing is that here's a study that shows that, contrary to popular belief, is that those people who take these proton pump inhibitors, and this is reported from the American Gastroenterological Association Institute, found that taking proton pump inhibitors, drug for 8 weeks, induced acid-related symptoms, including heartburn. So in other words, the thing that you took that gave you some temporary relief eventually ended up making it return, so you had to keep taking the drug. Well, it gets better. Then there's what's called the rebound effect. In fact, this was discovered in some reporter was doing some investigative reporting with the drug company and found out there were certain memos that said that inside the company they were talking about how these drugs are the perfect drug because once you get on them, you have grave difficulty getting off of them. In one of these studies, it was shown that 40% of the normal people, by that I mean they had volunteers who did not have any stomach issues whatsoever. They volunteered and they gave them the drugs even though they didn't need it to see what the side effects would be. Then they stopped them after a few weeks' time, and they found out that 40 to 50% of the people had grave difficulty getting off of it because when they did, they got what was called rebound effect, where their stomach would secrete massive more amounts of acid than it normally would. They couldn't stand it, so they'd go back on the drug. So they had to keep taking the drug or taper off slowly. More about that later. Here's another one. Here's a study from the. You see, this was reported in a Dr. Mark J. Reichert, pharmacy coordinator for a surgery at Wake Forest University Baptist Medical Center. They noticed a significant correlation between patients getting pneumonia after surgery, particularly patients that had to be ventilated if they were on a proton pump inhibitor beforehand, and but actually because they're on ventilators, they had a problem there. And remember, if you get a pneumonia induced by being put on a ventilator, you have a 20 to 30% mortality rate associated with that. So that's not a good thing. So that's another example. Then we have let me see some other ones here. Let me see. Prilosec and other heartburn drugs can double the risk of kidney failure.